I'll get you right back. Go ahead and follow me back this way.
Okay.
Have a seat here, and I'll be with you shortly.
Thank you.
You're welcome.
So we are doing a left carpal tunnel release today, correct?
Correct.
Okay.
My name is Misty, and I am here today to get Dr. Beall to do a carpal tunnel release on my left hand. I have had increasing numbness in my hands for the last several years, and I just did all of the non-pharmacological things to try to help it beforehand, wearing braces, physical therapy, and ultimately it has gotten to the point where my hands go numb even when I'm driving. So it's only going to get worse.
Everything comfortable enough so far?
Yes.
Good. Just like with your other side, the recovery should be a similar process. We'll have a little gauze wrap on your hand. You'll keep that on and keep it dry for the first 5 days or so. And after 5 days, you'll be able to take all of that off and wash your hand, and just keep a Band-Aid over those stitches until we're able to get those out, which will typically be at about 10 to 14 days after surgery.
Okay.
And key things as far as keeping it comfortable afterwards, elevating your hand, trying to keep your hand above your elbow and hand above your heart as much as you can. That will keep your swelling and inflammation down. That goes a long way to keeping it more comfortable. And ice packs will help. Typically 10 to 15 minutes at a time, every couple hours or so. That's most important over the first few days.
Okay.
And then motion is one of the important things as well. Just keep everything moving, keep those fingers moving. That motion helps to keep any scar tissue from forming around the tendons, and helps to work out a lot of the swelling too. That and go distal. So we're just about done. Alright, so come off there. So everything looks nicely released there. And I'm just taking a look to make sure that nerve looks in good position. It does. Alright, so you'd wanted to see how it's looking there. So what we'll do is have you bend your elbow. That, I'm going to adjust this to get in there a little bit better. And add some. So let's get this. So that's that ligament that we divided. So it's a little hard to see if you really look way over there. You can kind of see that nerve. I feel like
this incision's smaller.
It might be just a touch, not dramatically, but
wow.
So the nerve's off more to the thumb side there, and then you can kind of see it. It's a small incision, so always a little hard to tell.
Yeah.
And then you can move those fingers and see the tendons moving.
Where's the nerve?
It's sort of that more pink structure
off
to the thumb side there. So that's it there.
Wow.
Yeah. But nice and free now.
Neat.
No pressure on it anymore.
Thank you.
Sure. So come out there. So now we're going to rinse a little water through there to clean everything out, and then we'll put in a few stitches, and then get your dressing on, and you'll be all done.
It's amazing you can do it with such a small incision.
We just completed a carpal tunnel release, and it's a nice, quick, straightforward kind of procedure. Very effective for addressing compression on a nerve there. Nice that we can do these under just a local anesthesia now, where we don't have to use a tourniquet for it, which can get pretty uncomfortable pretty quickly, and allows for a nice, quick, easy recovery process. It looked very typical for what we see, where there's a ligament that makes the roof of the carpal tunnel, and that ligament is typically thickened, and as it thickens, it narrows down the tunnel. You get pressure on the nerve, and the nerve usually has a little bit of a reddened, irritated look from that pressure, and that's what we saw in this case. Everyone recovers a little bit differently because some people have more pressure, more injury to their nerve before they get to the point of having a release. So for them, it might take longer to recover. One of the things that we usually see pretty consistently is that pain gets better initially. The symptoms that wake people up at night, having to shake their hand loose to wake it back up, that usually gets better right away. There's soreness from the surgical site for a few months until the scar tissue forms and then softens back up. But people are able to start using their hand for light activities right away. It's difficult to do forceful gripping, usually for about 6 weeks or so.
You don't really feel a whole lot, and Dr. Beall's been doing it so long. So it's fast. I'm an ER nurse, so I just find it fascinating to look at it, and it's really interesting to see your tendon moving in there, and ligaments and nerves and just what they look like in real life, I guess. No more numbness. Being able to move my hands in any way that I want to without having any numbness or having them fall asleep, or it's life-changing.
This is all the instructions we went over with you verbally. About your dressing, you want to keep everything clean and dry till Sunday. You'll take your dressing off. You can shower, wash your hand as normal. Once you're done, just want to keep the sutures covered with a Band-Aid. Try to use your hand as much as normal. Just don't be doing any heavy gripping or heavy repetitive motions.
But I can kind of make a fist type thing. Okay.
But nothing clenching super tight.
Right, okay.
And then for pain and swelling, we want to elevate over the heart and elbow. Icing that he talked to you about.
All right. Thank you so much. I appreciate it.
You are very welcome. I will send that with you.
Okay.
Get that there. And if I could just get your signature in that box, you are good to go. Alrighty. Once again, I'm glad we was able to get this taken care of for you.
Me too. Thank you so much.
I'll see you at your post op.
Thank you.